goals. And now we're going to do one more thing here. You. Speaker. Okay. Yeah.
Okay, thank you.
Okay.
I'm just gonna pull the presentation up here
Okay.
because I have some notes and I don't wanna misspeak. So bear with me 1 minute.
So while you're doing that, I'm just gonna thank Hillary and Susie for coming by today.
We also wrote Sam.
And Sam. But nice to meet you, and good seeing you at Town Hall to present for us today. And thank you to John for setting everything up. You know, we're doing this Eastham Focus Series once a month. So we're bringing folks from committees, departments, just to talk about, you know, what everybody's doing and what's available to you guys as community members, so.
Great, thank you. The Health and Environment Department is located, while I'm seeing if this will load for us.
No. Town Hall?
No,
The building next to town hall, next to the fire department.
yes, exactly. So we're the small brick building in between town hall and the fire station. There's parking in the front and there's parking in the back. And there isn't a lot of signage. So if you see the small brick building, that's where we are. Okay. And we have a pretty lengthy mission statement. We want to advance public health by preventing illness and promoting wellness and fostering healthy behaviors and patterns. And we achieve this through comprehensive research, rigorous inspections, regulatory functions, policy development and setting, disease investigation, surveillance, advocacy, education. And our commitment is obviously always to create a healthier, safer community. So that's a lot of words, and we'll get into what that actually means in a few slides. But to run through who is in our department, it's myself, it's Susan Barker, who's our health agent. She spends a lot of time out on inspection. So she goes to septic system inspections, food service inspections, swimming pool inspections, complaint inspections, housing inspections, you name it. Then we have Richard Scally, who is our housing inspector. He is sort of the chief lead on the rental certificate program. He inspects a lot of the rentals in town. He works with Sam, our admin, to administer the permitting process and get all of that off the ground. So behind us is the Board of Health, which is a 5-member board with 2 alternates. You can see the membership there. We have a chair, a co-chair, and 3 members. And 2 alternates, but I think at the moment we're down an alternate. So if any of this interests you at all, go ahead and apply. And so also in our department, which is sort of a new department to the town of Eastham, is the Conservation Department. And that's head up by Alexander Bates, who's not with us today, and Amy Blakesley, who's the admin on that side, and a Conservation Commission of 7 members and no alternates. They're also down a member, and I believe they're giving a presentation here, I think next month. So if you want to learn about them, come on down and they'll tell you all about the conservation end of things. I want this to be as informal as possible, so if you have questions, jump in, ask them. I'm happy to stop at any time. Susie can field questions, Sam can field questions, so let us know what interests you and what doesn't. So environmental health is where we spend a bulk of our time. I think that the state would like us to focus more on public health and outreach, but we seem to have a lot of environmental health tasks that take precedent. So here's a slide. And Debbie, I'm not sure if you can see, but you're in the corner of the slideshow. Can you see? So these are some of the topics that come in under environmental health. Any of them look familiar? Yeah?
Sure.
Okay, so We do some asbestos abatement and remediation permitting. So when building projects get underway, we receive forms from the state, folks have to file to remove asbestos. Next, we do noise pollution, we do air pollution, we do bathing beach sampling and pond sampling. We do burial permits, birth certificates, death certificates, and burial permits.
Is that the lower left-hand corner?
No, that's this one right here.
Oh, that's the burial. I thought that was the spot of the everything.
The bottom left is campgrounds. So family style campgrounds, we permit family style campgrounds.
Oh, so that's the one over here.
Yes.
Bigger than I realized.
We do radiation control, and while we don't have too much of that going on, you never know when a tanning salon might come into town. So tanning salons fall under that. We do hazardous waste collection, removal, and sharps disposal.
Are the sharps container at your place now as
We-
opposed to the,
They're at the fire station, and police station.
so we just go there then?
Yeah, and also, which you'll see in another slide, we have the AIDS support group in town. They also do sharps disposal and collection, so if you need that service, you could reach out. They do, home visits, and they also are stationed at the library in the mobile outreach van, monthly.
At the van in your parking lot, please?
It's not in our parking lot, it sits at the library, actually. So we've spaced out some services around town.
Okay.
Food safety is another huge aspect of what we do. Susie, how many restaurants in town? Or Sam? 48 restaurants, we have gas stations, we have small stores, so everywhere where you see food, we get out there and do an inspection at least twice a year. We receive some assistance with that. In the summertime, we get an intern from Barnstable County, which we have fun with. They're usually young and spry and learning, so we show them the ropes and get folks interested in public health that way. But every food establishment gets a couple of inspections a year. We're in charge of solid waste regulations and recycling regulations. Any questions on any of these topics?
What was the one on the bottom there to the left?
This is a family style campground, so
Oh.
campgrounds.
Okay.
Oh, dear. Uh-oh.
That's great.
Okay,
There we go.
we're good.
We're good.
We're moving on anyway. Here we have oil spills, gasoline spills, diesel spills, home heating oil spills. We don't see those a lot, but it's something we have to be well versed in because they cause a lot of environmental harm and damage. You never want to see that. To the top right, that's housing. So we do housing inspections for the rental certificate program, and also if we get a complaint in from an occupant, we go out and inspect. So there's a thick code on housing. Solid waste, that's our transfer station and recycling. We collaborate with John Ruffley. You look like you have a question. No? Okay. Don't be shy. Okay. Lead exposure. We see lead paint in some of our older homes, and there are lead paint rules and regulations, especially when children are involved. I'm going to come back to the next one. Anyone know what the one on the right middle is? No, close. Kids, yes. Camps. Yeah. There's a dense regulation on camps, so that falls
Do we have
into.
camps in town?
We have a soccer camp, correct? We have the rec department. Town rec departments don't fall under the regulation, interestingly enough.
Oh,
But we have a soccer camp that's separate from the rec department,
Yeah, and it operates out of the high school during the summer.
so it's part of the rec?
It's part of the high school.
Oh, but the high school falls under.
And Billy's Gym tried to have a couple of camps recently. And we spoke with them about all of the regulations required to be a camp, and I think they steered away from that direction and called themselves perhaps an athletic program. So if you call yourself a camp, you're a camp, and we get involved, and the rules are quite stringent. I think everyone's familiar with the bottom left, septic systems, wastewater, drinking water. Anyone have a clue what the bottom right is? It's tight. Cyanobacteria. So we have a rigorous pond sampling program with APCC, the Association to Preserve Cape Cod, for cyanobacteria sampling. We started this 2 summers ago for the cyanobacteria. It's an up and coming problem that we're seeing in ponds across Cape Cod. So we're trying to get some baseline data at the moment.
What does it affect?
Cyanobacteria, it can kill pets. It causes gastrointestinal illness in humans. And when you have it in your water body, you have to shut your water body down to swimming. Okay, and then the middle one is nuisance, right? So nuisance is pretty much anything from folks calling us about their neighbors overflowing garbage, or I smell burnt toast all day. What is that smell? It could be someone has a pig in their backyard and it's not permitted and it's oinking and I don't know what to do. So pretty much anytime you're frustrated by anything, it could be considered a nuisance and we'll come out and inspect. So we follow up on all complaints as required by law. So there's a lot of times we go out and look at things and we're like, I'm not even sure what I'm looking at. Or most of our nuisance complaints, I would say, are in the garbage realm, trash overflowing, smell.
Who would give permits for farm animals?
Hold that thought. Any questions here? So backyard, non-commercial farms come to us as well. So we permit chickens, we permit horses, we permit goats, pigs, you name it.
Do beekeepers have?
No beekeepers. Beekeepers aren't subject.
Oh.
No, I'm just
Kind of, yeah.
And swimming pools, of course. So commercial swimming pools. We do not permit backyard swimming pools, only commercial swimming pools.
But they need a permit to be built,
Yes.
a personal.
Yep, and we do review almost all of the building permits that come in are supposed to get routed through the health department. So we check a building permit for bedroom counts and to make sure components aren't coming too close to our septic parts.
Yes, yes.
So we do have a look at all building permits also, which I didn't put on there. There was one other thing we talked about, PFAS. We didn't talk about PFAS, but I'm sure you've heard about that in passing. We do have PFAS in some of our private water wells around town. Mass DEP had done some sampling here to residents that were interested. So we have some hits of PFAS and we have very minimal PFAS coming from the transfer station, but most of the folks surrounding the transfer station are already connected to the municipal water system, which we're very fortunate to have. Okay, so we also get into tobacco use and prevention. We have regulations in the Board of Health regulation. The state enacted the Tobacco 21. There are all kinds of requirements for signage and no flavored tobacco products, and the products are always changing. So we get education on these things because there's no way we could keep up on them. There's new vaping devices and cigar holders, and all kinds of things. And our main goal is obviously to keep these products away from our youth because we know that their brains aren't fully developed till 21. And so we do a lot of work in that area. Susie goes out and does the inspections. We educate our retailers. And we occasionally have some promo information on helping to quit smoking. So
Does DPH give grants? And I know they used to. Is there any money that the state sends down to
we
the
don't
towns anymore?
see any of that money directly because the county holds the tobacco
Oh,
program.
they do?
So the money funds from the state to the county, and then the county comes out and does these sort of undercover stings, which our business operators really don't like, but they go in and try and buy products without IDs, and then we get a report and we follow up.
Are
So
they
there's,
doing any cessation programs?
you know, I have not seen any advertising for a cessation
On
program
the Cape?
in a long time.
In a long, yeah, I know they're using.
Yeah, in a long, long time. I can certainly ask.
I'm just curious.
Yeah, it's a good question, but you could call the number and probably get all the information too that you need. So we can look into that for sure. Anything you want to add? Any questions? Disease control and prevention, I'm sure COVID is probably top of mind here as what does that even mean? These are the list of reportable diseases to the state. So anytime any of these come in, we have to either call the state immediately or reach out within 24 hours. Now, we don't see a lot of these things regularly, but you know, the ones that come to mind, hepatitis A, influenza. So sometimes we do the reporting and sometimes your practitioners do the reporting. So it depends on how the information comes in. We have an online disease database that holds all of the diseases of all of the residents of all of the communities in the Commonwealth. It's pretty extensive, it's highly secure, and so we can query diseases, you know, throughout the year and see what's spiking, what's high, what's low. I like to look at it end of summer and see what the tick diseases look like, because that's one of the ones we see the most prevalence of here in town. So on the back table, we have the treated tick socks. For anyone that's interested, we've passed them out at a couple of different events around town. We have plenty. My hope initially was to deliver a bunch to the school, kid sizes and adult sizes with the trail map that the conservation department was putting together. We don't have the trail map yet, but we want to get the socks out. So socks back there for those that are interested that go out hiking.
Good for what use? Washable or?
They're washable, so they're treated. I believe that they can go through a number of washes, and I think it says it on the packaging. I just don't remember the number. That same company will treat any article of clothing you have. You can send it to them. They'll treat it and send it back to you, and then you have the protection on your clothing also. So those are the diseases. You can't read this and it's not important to read this, but these are all the other things that we have to do with infectious and reportable diseases. This covers rabies control and protection as well. And I think you probably all heard that we had what we call the raccoon. I don't mean to be funny, but it was a raccoon covered in porcupine quills that was found down by Wildcare on the side of the road dead. So it was picked up and tested because we don't have porcupines on Cape Cod, let alone in Eastham. They sent the raccoon for testing. It came back tested positive for rabies. So the first question was, how does this happen? Do we now have rabies here? We have a rabies control program that was run by the USDA for many, many years, where they drop aerial baits and ground thrown baits to treat the wildlife population to push rabies back. So there hadn't been rabies on Cape Cod in many, many years. And then this raccoon shows up in Eastham. So this was around Thanksgiving, I want to say. It was, yeah, it was really recent. And so we did a lot of publicity trying to get the person or persons involved with the raccoon to come forward, because if you interact with the saliva of this animal, you're at great risk. Nobody ever came forward. Turns out the raccoon came from the New York-Pennsylvania border. So the USDA has a way to sample these animals to see what strain of rabies it is. And so it came back from being out of state. We're still doing surveillance of dead animals to make sure, you know, that we actually don't have rabies here in town. So the thought is we don't. The raccoon came from far away and landed here somehow mysteriously, and no one ever came forward. So that's on that list of things. We have the ability to quarantine people if we think they have a disease that requires them to be quarantined. We talked a lot about isolation during COVID. I think we're all familiar with that. We have the ability to get a warrant and take materials if we think they're contagious, containing contagious materials. A lot of strange things on this list that you wouldn't think we have the ability or want to do, and I don't think we want to do any of it, but we would do it if we had to. So, any questions? Okay, so some of our non-regulatory initiatives, this is the stuff I find most interesting and fun. We've done some opioid programming. We've got Winter Wednesdays. We've gotten a couple grants through ARPA for some really special people to have around town. We've conducted a community health needs assessment. We do educational trainings with regularity, health fairs, vaccine clinics, and our community fridge.
What are Winter Wednesdays?
Hold tight, we'll get to that.
Okay.
So as part of the opioid remediation programming, each community in Massachusetts received an allotment of funding from the drug companies through the Attorney General's office to host programming with the sum of money that we got in. So we try to focus our efforts on harm reduction, treatment, recovery, and prevention. So Eastham partnered with the Outer Cape towns, Truro, Wellfleet, and Provincetown, and a group called Outer Cape Community Solutions. You may or may not have heard of that. You might have seen OC Wellness around town on various flyers, but Outer Cape Community Solutions is a collection, I like to say, of a lot of the nonprofit organizations that work out here that all do good public health promotion, education, and advocacy. So we have an MOU with that group, which you may or may not know, to tackle some of these things that we just don't have time to do. So as part of the opioid remediation program, we've contracted with the AIDS Support Group, which is the mobile vehicle you see in the right on the second picture down. That's what's at the library. So when you see that at the library, you can go, you can drop off your sharps, you can get Narcan, you can get fentanyl test strips, you can talk to them about any STD, sexually transmitted disease you might have interest in. They've got a lot to offer. So that's parked at the library. We offer 2 different yoga recovery classes. One is offered at the Chapel in the Pines in Eastham, and one is offered in Wellfleet at the Senior Center. 2 different practitioners, both teaching yoga recovery. So
that's through OCW?
that's through Outer Cape Community Solutions and the towns.
Oh,
So
okay.
all 4 towns. So it's the towns that
I've seen it advertised, I didn't know who
Yeah,
was doing it.
so anybody can go. I mean, it's not exclusive, but if you have a tie to a substance use issue, person, whatever, you can go and they'll help anybody. So all of this is free to the residents. We do Narcan distribution. We have Narcan available at the library, the police station, the health department. And that's it. We were trying to get it into Cumberland Farms, but I think we've lost track of that. So still would be our desire to get it in there. We have a couple containers of Narcan on the back table if anyone is interested in taking that. It works kind of like an Afrin or a nose spray. So that's available back there. We work with Outer Cape Health Services and their SOAP program. And we're able to provide them with funding to offer classes that are not covered by insurance. So they do some sound movement, they do art therapy, acupuncture, and sort of off the grid programs. We work with the Cape Cod Children's Place also, and we give them discretionary funding. They run the First Steps Together program, which is for families of substance use. So that's a good program if they need money to get their car repaired, if they need money to get groceries, to pay bills, it's available through them. And then, of course, all of our services are free and we do provide transportation. Winter Wednesdays. This was a program that we developed, I think it came to Eastham 2 years ago, but it started in Provincetown several years ago when we were seeing that during the winter months on Cape Cod, our residents were feeling lonely, they're feeling depressed. And so we wanted to give them an opportunity to get out, socialize, do something fun, learn something new. So we now offer Winter Wednesdays in all 4 towns. You can see we now have 4 classes in Eastham. So that list is growing. There's virtual programming. And any resident from any of the 4 Outer Cape towns can go to programming in any of these places and join in. There's transportation available if you don't have transportation.
Who
So-
provides the transportation?
The taxi cab, Provincetown Taxi.
Really?
So you can call and get transportation. There's childcare also available at the Provincetown location if needed. So that's the list of the ones going on this winter. The information is on our town website, Sam, you put that up, right? And we did a news flash on it, so you may have gotten an email.
The link to register.
And the link to register, and I would say register soon, because from what I heard, people are already registering and, some of the classes are filling up, but it's designed to be a drop-in, so you can go once, you can go twice, you can go as many times as you want.
So if you don't register, you can still drop in?
I believe you can still drop in, but if it's an online thing, you're gonna have to
Yeah,
register. But there's a really fascinating one that I covered my ears when we were talking about, and Susie, cover your ears. It's this one, which interests me personally. Oh no, I shouldn't touch the screen, right? It's fermentation, and they're gonna talk about all kinds of food fermentation, which is super cool, so.
Oh, neat.
So that's available. Sorry, Susie. Your ears aren't covered. It's not interesting, I promise. This is our community refrigerator. This is located in our office, in the back of our office. We have a number of folks that have donated and continue to make donations. We have the Family Table Collaborative that comes and delivers us a couple of meals a week. Those meals also get delivered here. We get a delivery from Capabilities, which is really fantastic, and it makes my heart happy. They bring us this beautiful produce. We have the Midnight Hour Company that delivers frozen clams. We received money from Eversource and Albertsons Supermarket. So in the summertime, we've received food from the Food for Kids program. So we've been running now probably since July. And we have, a handful of people that wander in. Again, this is free. You don't have to be in need. It's open to anybody. Sometimes in the summertime when we had a lot left over, we would go out and, hit up the tennis courts, the basketball court and the playground just to get the food to kids and families. But it's available. It's fully stocked today. I think we have 100 pounds of clams in there that were delivered this morning. We got produce and Family Table Collaborative meals. We've got fish chowder and haddock stew, and you never know what's in there. So
The purpose of this for people in need, not those.
no, so a community fridge is different. A community fridge is open to everybody. You take what you want, you leave what you don't. Ideally, people in need would be the ones that come to it, but there's stigma associated with that, right? So you don't want people to feel uncomfortable coming in thinking that this is just for people that need it. So anybody can come in and help themselves to whatever they need.
I guess I would feel guilty going there. You're saying clams, I'm all over it.
Yeah.
You know what I mean?
Yeah.
I would feel guilty doing that.
You don't have to feel guilty. It's for the community. It's for the community. We have 100 pounds of clams and the company is willing to bring them back to us. Everyone understands the intention of what the fridge is. And if we all use it, those that actually need it don't feel guilty about it. So it's there if you want it. If you're not comfortable, don't come, but it's there. And we enjoy when people come in because it brings people into the health department. We also store our Narcan back there, so someone could come in, get their food, get their Narcan, and go out the door. So we're working on expanding that to have some dry goods, some personal care products, and maybe some books and literature. So it's a nice little space. It's contained in the back of the office. Even if you don't want anything, come and check it out, because it's just nice to know that it's there.
I guess that's my question. This is great. My question is, it is way in the back of the office. You have to walk through the building and everyone gets to see you.
Well, we love to see you. Come in the back door. Come in the back door.
But for those of us who may not want to be seen by everybody.
You can come in the back door.
You can come.
Yeah, there's 2 doors in the office, front door, back door.
Because that was my thought, my experience, I went once.
Yeah.
And doing that was like, oh, good.
Don't be shy.
But I'm just saying.
Yeah, come in the back door.
Because I originally thought, oh, it's right in the front, just like the COVID tester right in
Yeah.
the front. I thought I was gonna scoot in, right?
But you got to see all of us.
Correct. However, for those who might,
Yes,
Not
they can
want
certainly come in the back door and go right in and go right out, and no one will even talk to you. If you walk by me, I'll talk to you.
Does the health department have a homeless prevention program?
So we don't have a homeless prevention program, but we work with the Homeless Prevention Council as part of the Our Cape Community Solutions Network. And in town, we have a house, I'm gonna get her title wrong, housing coordinator. So if folks are experiencing homelessness or fear of homelessness, they can reach out to Rachel Butler at Town Hall as well. And we have connections to the Homeless Prevention Council. Health needs. So health needs is an interesting topic. We're in a rural space, so access to practitioners is very difficult, we've learned. We've done a health needs assessment, which has reiterated that to us. We can hold health fairs. I'm not sure how successful they actually are. We held one last year around this time, and it was semi-well attended. I think we also struggle with getting the word out about what we're doing. Communication, I think, is one of our most difficult areas to do, unfortunately. It's not as easy as it once was with social media and websites and emails and newspapers and radio. So we definitely struggle with that. But we understand a lot of what the needs are. Aging in place is a big one. Access to practitioners, access to mammograms is another one. Vaccine clinics is something we do regularly. I'm sure everyone's familiar with that. We held, I think it was 5 flu and COVID vaccine clinics this fall. One at the Elks, which is the big drive-through, one at each of the schools, 2 at Town Hall. And one of the clinics we held at Town Hall, we enlisted the help of DPH, and they came with gift cards. So I think that might have been one of our most well-attended clinics, was the one where they were distributing free gift cards to people for getting vaccinated. We're working on a Tdap vaccine clinic and a hepatitis A vaccine clinic, but there's a lot of red tape and rope around that because Tdap, that's for the whooping cough, pertussis. It's the tetanus, diphtheria, and pertussis all in one. There's a big rise in whooping cough, which I'm sure you've heard across the Commonwealth. And what I've gathered is that our vaccine wanes over time. And so we really want to encourage people to get that vaccine, and we want to make it as easy as possible. Again, we're in a rural community. We have Outer Cape Health, and we don't have access to a lot of other medical providers to provide it. And the state has told some of our providers that if the vaccine drops in temperature by a number of degrees, then it's useless. And so we're working with the rural health department at the Commonwealth to try and find a way to make that available. So I'm hopeful, but my hope is probably down here where I wish it was up here. So we're working on it. Hepatitis A, we thought would be really great for the population and also for our seasonal workers. So we're going to try to do that in the spring. All of our septic employees would probably want to get that, food service, hotel folks as well. Questions? Comments? One of my favorite programs that we run, which I think some of you know about, we received a grant from the county through the ARPA funds, which they released shortly after the COVID pandemic ended. And again, this is working with our colleagues in the 4 Outer Cape towns. And we came together and we said, we know people are really suffering here because we're so far away from cities. What do our people need most? We know there's a big mental health crisis, and we know people need access to a nurse, even if it's just to ask a quick little question. So we put together an application to fund a nurse and a mental health clinician for the Outer Cape areas for all 4 towns. In addition to that, a program we already had running was the Navigator program. So I think of the Navigator as someone who can help you with anything. So any kind of question you might have about housing or heating or food or substance use or whatever, they even come and help you clean. Like, they're the greatest people in the world. So in the past year, we've had 100 referrals received to our Navigator program. Referrals come from fire, police, COA, the hospital, the high school, the Lower Cape Outreach Council, Homeless Prevention Council, Outer Cape Health, some people self-identify, and family and friends. So The majority of the presenting concerns were food insecurity, financial insecurity, housing vulnerability, transportation issues, mental health, aging in place, and substance use. So this program is available. You can self-identify, you can reach out. You can reach out to any one of us and we'll guide you to the navigator. But they're lovely, lovely people who only want to help. It's a really great program. So the town therapist came on board, I want to say late summer, early fall. And so far, they've received 21 referrals from the town of Eastham. Now, remember, they work in all of the Outer Cape towns, so there's a limited load that we can put on the therapist. It's supposed to be short-term help to get them to the next stage of whatever it is they need. Our therapist, Cassie is her name. She's been here. Some of you might have met her at the, I don't want to get the name wrong, but it was Creative Connections, or we made ornaments. It was super cute. And the nurse, Carrie and Cassie were there sort of introducing themselves. But Cassie can do cognitive behavioral therapy, psychotherapy, and motivational interviewing. Those are the 3 techniques that she practices the most. Our referrals for the therapist came from police, fire, COA, the elementary school, the visiting nurses, and Outer Cape Health. Majority of the things they're seeing are depression, anxiety, trauma, grief, ADHD, and substance use disorder. So in order to access the therapist and the nurse, it's by referral only because their time is so limited in each of the towns. So if you know folks that need help, you can reach out to me, you can reach out to Susie, you can reach out to Sam, police department, fire department, housing coordinator, here, the library is aware of it, but we want to make sure those in the most need can get the help before they end up in crisis. So then we have the town nurse, Carrie Cox. I've known her for years. She's absolutely so sweet and willing to help with anything you can imagine. She spends her time doing clinical assessments, teaching, and communicating. So sometimes it's difficult for residents to make the connection from provider to provider. She's good with that. She can do medication management. She's just a really great resource. She's received 16 referrals. Police, fire, COA, visiting nurses, and Outer Cape Health. She's seen folks with dementia and managed family dynamics around dementia. I actually took the opportunity to talk to her one day on a call because we have some of that going on in our family, and she made me feel a lot better about things. So she's a great resource. Even if you think you don't need her, she's available. So chronic disease management, advanced care planning, and safety planning. But she is a registered nurse and can do anything a registered nurse can do. I'd be remiss if we didn't mention this topic, going away from my favorite stuff. This is enlightening also, but in a different type of way. I'm sure you all know that our estuaries are suffering from nitrogen. It's nothing new. We talk about it a lot. And these maps, the map is phase 1 of the collection and treatment, which is the sewer system. The second map shows phase 2 and shows you all the different watersheds in town.
Which one's one?
This is phase 1. So this is collection and treatment for the Salt Pond watershed.
Yeah.
Here's Schoolhouse Minster Pond. North Eastham, we catch some of the business district up here. This is ongoing. You'll see a lot of this. You'll hear a lot more about this education-wise. We have a website that's about to be released to the public. And we're currently designing collection and treatment here. On the far right is a brochure, flyer, information sheet on cesspools, Title V's, and innovative alternative septic systems. We recently did a presentation at the Board of Health meeting. We brought in some folks from the county, talked about low interest loans financing, what these different types of systems are, how the different innovative alternative systems are functioning, and what to do with your cesspool. So we have 278 cesspools in town. The board is considering regulation on what to do about them. So wastewater management.
Are these maps online, Hillary?
They are online. The website is kind of hidden at the
Yeah,
moment because
Find them.
it's being refined. The engineers are looking at it to make sure everything's good to be put out to the public.
Okay.
So they're absolutely available. And I'm sure that Kayla, who's doing our PR, will push them out to everyone. That's the intention. So
Okay.
it's coming.
Okay, are these the maps during your, meeting with the, cesspool people?
Yes.
Those, okay.
Yeah,
gotcha.
yeah, so we have these maps, we also showed maps, of where the cesspools were located in town.
Right,
We showed maps of where the different IA systems were located in
yes.
town. So there's a couple different maps around. This is mainly just to show the collection and treatment area and the watersheds
okay,
that we're focusing on first.
okay, and these will be they'll be
It's
available.
all, it's all of it.
Okay, great, thanks.
Pond water quality is another area that we're quite serious about. We have a presentation, we have a new pond report, compiled from data through 2024, new pond fact sheets. We're going to hold a information session this winter, debuting that so you can see how the ponds are doing and where we hope to go. Those are our monitoring recommendations going forward. We want to continue to monitor them. We know that ponds are sort of one of the selling points of Eastham, and we don't want to see degradation in the water quality because when that happens, we all suffer. Property values go down, the ponds don't become usable, no one wants to recreate in them, fish in them, swim in
Did
them.
we close any ponds this summer?
We did not close any ponds.
Not for.
Yeah, not for swimming, we didn't close them for cyanobacteria, we didn't close them for bacteria, so no. And I know I had a couple people on my list that would call and say, oh, can you tell me how the ponds are this week? So I would forward them off the data. So we get, the ponds are sampled, ponds and beaches are sampled once a week. We don't have any guarantees, beaches, do we?
Memorial Day through Labor Day, yep.
And then cyanobacteria sampling continues further into the fall because we know that it becomes a problem later in the fall as well. So that's all ongoing.
Do
as
we
well.
does the town do the monitoring, or is it through
So-
APCC, or?
APCC does our cyano monitoring.
Okay,
The town does the estuary water sampling and some of the pond water sampling. We've worked with Center for Coastal Studies as well.
okay, thank you.
Stormwater, another part of wastewater. We're currently working on salt pond, so we have up to 8 different stormwater controls that we're working on, modifying and improving. So that's going on as well, all to increase our water quality.
So where will the will it be barriers or?
No, it's all underground construction and,
So you're,
planting beds are used underground
Okay.
treatment.
okay, so that, okay.
Because a lot of the Route 6 runoff right now just runs directly.
Yeah, yeah, I mean, you can see it.
Which
when
is
you're
too
on the
bad,
road.
yeah, so we're working on all that too.
Yeah, okay,
Is that the salt pond landing?
Yes,
Yeah.
it is.
yeah,
So there's a whole retention basin system that's gonna go in there, the landing will get revamped, some retaining walls and guardrails, maybe a sitting bench.
oh, good.
Will it affect kayaking?
Nope, the boat ramp stays, the boat ramp stays,
Selfishly asking.
yeah, no, the boat ramp stays, this was funded by USDA. All of this stormwater work, so
When will is there a timeline on this? And,
I don't think we expect to get done permitting till 2026.
okay, well, that's next year. So,
Feels like forever.
Please do. well, some stuff takes long, like,
It
know.
all takes forever.
You look at Herring River Restaurant, it's like, oh my God, I'm talking decades, so that's not bad.
Yeah.
Next year's okay.
So we'll get there. Cool. So, whoa. What is public health? I hope I was able to give you a good enough overview so that you understand what it is we do in our small brick building in between town hall and the fire station. It's a lot of stuff. We have to know a lot about a lot of different topics, and we certainly don't know everything, and we learn a bit every day. So I'm happy to answer questions. We brought some supplies.
About a
Yeah,
rate,
go ahead.
because you're seeing it everywhere now, the rates of all the different, COVID and this, the flu
The
and.
respiratory illness.
Where are we at in town?
So we don't actually have town by town data on respiratory illness because how many people, walk around with the sniffles or a cough and none of it is reportable. So many people now don't even report their COVID because they're not sampling for it or it's not a requirement. So we can see respiratory illness rise in our area on Cape Cod in Barnstable County, but we can't get down to the nitty gritty because many of these respiratory illnesses, whooping cough aside, are not reportable.
I know Boston.
So wastewater, they just said recently that wastewater is not a great detector, and I'm trying to recall, this was just on Tuesday in a call, where they sort of discouraged us from looking at wastewater. So we've looked at wastewater in Provincetown for COVID, and that seemed useful. But when you go to try and look for different variants of flu, like it just becomes muddled together and it's really difficult.
So it's only the Barnstable numbers we can.
Yeah, so the county maintains, the county brought on an epidemiologist, I think a year or so ago, Leah, and she puts out a report, pretty regularly.
Yeah.
So I would check the Barnstable County website
I
and see,
get there. I was hoping it might be a little more broken down, but I
Yeah.
hear what you're saying.
yeah, very difficult,
So it's not reportable anymore,
correct.
even if my doctor chooses for it.
So if you go to your doctor and you get a formal test, then I believe you get into the system.
Okay.
If you take a home test, you're not in the system.
Okay.
Okay.
Go ahead.
You mentioned the department has responsibility for permitting animals. What about the health and safety of the animals after they're permitted?
So the health and safety of the animals after, we work closely and collaborate with Stephanie Sykes. She's our animal control officer. And Susie and I have some level of expertise with animals, but we would refer to Stephanie for anything that we weren't capable of. She also picks up the dead birds on the side of the road and, other deceased animals to test those.
Yeah, I have a question about the reasons, are the regulations about garbage pickup, these private garbage pickups, like a time, that they're allowed to do it, or is it pretty?
So we don't have time requirements. Matter of fact, I had emailed our building inspector this morning about construction times. Do we have construction
Yeah.
times?
That's the other thing.
And I didn't get his answer back yet, so I don't know. And I wasn't asking because I thought one of you were going to ask. I got a question from a contractor working on our wastewater design, if they could start at 7 o'clock and end at 5 o'clock. And I was like, gosh, I don't know if we have times here. So I don't know that answer yet.
Well, there's times I get woken up pretty early from the car, the truck backing up and the beeping.
The beeping of the truck, yeah. I don't know the answer yet.
But I was just wondering if there were regulations.
Yeah. That's a no, we don't have a noise bylaw.
Okay.
So let me just show you what we've got. Don't be shy. We've got the permethrin treated socks. I recommend you all take them if you go out hiking. We also have children's sizes. So if you've got kids in the family, come to the office and grab some. Information on the Aqua Fund, which is the low interest loan program through the county for septic upgrades. So Narcan. We have our water test kits for your drinking water wells. If you happen to still be on a well, we do recommend you sample them once a year. Some goggles for those that are interested. Just a fun kind of item, I don't know. We have some gloves, part of our COVID stash, if anyone needs gloves for cleaning the sink or cleaning dishes or whatever you might need. We have 2 different types of face masks. We have the N95 and then the regular old protect your nose. Any questions?
Thank you for this. And the meeting.
Good. I'm glad. Come and see us anytime. We're happy to answer questions or get you what you need. Good, I'm glad. You're so welcome.
Yeah, thank you. Comes from a lot of help. You did make a great thing, you know?
Yeah, I know. I know, but it still, it never feels like enough.
I mean, you know, it's
Like,
yeah, it's whatever.
I mean, it's all public health. It's all public health. But like, the feel good stuff, hey, you know, so we have to go back and fill out all these metrics all the time. Yeah. No, no. I think they like woke up one day and were like, really, we don't know, all 351 communities do, like, some are doing more, some are doing less, some aren't doing any. So I think they came up with these new, like, public health excellence grants, and then they came up with like, what do they call it, like Safe 2.0, like all these new names and terms for like the basic service delivery of these students. But the point that I'm always making to them is that because we're a little different, number one, we're not a city, number two, we're rural. And number three, we have resources. Like, we don't have unlimited amounts of money to do things, so we have to regionalize and partner and collaborate. We're doing good, but you know, if we had more money, maybe we'd have our own, we'd have our own mental health clinician.